apart from therapy and medication, other things that people can do to help their OCD is just trying to reduce the general stress level in their lives, whether it's, overworking oneself or burning the candle at both ends, getting a proper night's sleep, just general stress reduction, kind of keeping yourself at bay with people who are toxic in your life. Just things that keep your general stress levels down, because once your stress levels go up, people tend to default into the OCD. So anything can kind of trigger that OCD, and that baseline level of stress is crucial if you can keep that at a lower threshold, your ability to spike it might decrease your ability your frequency of your spiking. So mindfulness is another technique that is very useful in decreasing anxiety and allowing the acceptance of one's thoughts. So mindfulness principles basically hold that we don't have control of our thinking patterns, and so when a thought comes in, you just watch it, you let it be there as kind of a mindful observer of that thought, but you don't try to judge the thought. You don't try to change the thought, you don't try to make it go away. You just allow its presence and letting it be there along with you until it chooses to leave you versus you saying it should or shouldn't be there. Exercise can be very helpful in terms of stress reduction, in terms of studies have shown that exercise boosts serotonin levels in the brain and can almost have a meditative effect on the brain. So exercise can be very helpful in terms of stress reduction and decreasing some outside aspects of the OCD. So eating well, exercising, getting enough sleep. Sleep can be, having a lack of sleep can oftentimes, clients will come in and say, I haven't slept well this week, I'm spiking a ton. Because my sleep's been disrupted. So if you can kind of keep consistency in those avenues of your life, you can, in general, just stress and coping skills can decrease that. Alcohol and other recreational drugs can trigger anxiety and can trigger spikes, so avoiding those as much as possible could be beneficial. Even though alcohol seems to have a decrease in your anxiety systems, when it withdraws from your body and leaves your system, it'll cause an uptick in that. So if you can minimize your use of alcohol or other recreational drugs like marijuana in general, it can be helpful for decreasing anxiety. And just general decatastrophizing. Not catastrophizing other events in your life. So in the workplace or in school, if things come up, trying to decatastrophize your language. Keeping your language at a more tempered rate instead of saying, oh, this is awful, this is terrible, I can't stand it. Tempering language to this is more challenging, this is difficult, but I can get through this. More coping language can naturally kind of train your brain to not go to those anxiety places.